We learned this week that Texans owner Bob McNair has gotten a clean bill of health after a 10-month battle with 2 types of cancer. McNair has dealt with skin cancer for about 20 years, but he was more recently diagnosed with a chronic form of lymphoma that lowered his immune system and made his last bout with skin cancer much more invasive and much more difficult. Now, did you know that 1 American dies every hour from melanoma? Well, Dr. Sherry Ingraham knew that. She's here to tell us what to look for when it comes to skin cancers, what are the signs, what treatments are available, and just to maybe hopefully dispel some kind of lackadaisical attitudes when it comes to it, because everybody likes their tan.
They do, and 1 in 5 Americans in their lifetime will develop skin cancer, and these are really troubling statistics. The rates of melanoma are skyrocketing, so we need to take action now.
And we've even seen it in the African American community.
Absolutely. Darker skinned individuals are not in a better position necessarily because we all need to check ourselves, and that's the key. We need to do a self-skin exam on ourselves. We tell our patients once a month, get yourself, get a loved one, look at your back, look at your feet, because they can occur in areas you wouldn't expect.
Your feet.
Right. Melanomas, especially in African American populations, are more prone to occur on non-sun exposed areas, such as the feet.
Strange. What are we looking for, doctor, when we check ourselves out?
So you're looking for moles that are changing or growing. So we always hear about the A, B, C's, D's, and E's. So A is asymmetry. You're looking for a mole that's changing in its border. That's the B. The color's varied. So sometimes a mole will start brown but turn red, blue. It's those color changes, diameter, enlarging diameter. And the most important is E, evolution. If something starts looking one way and you just sense it's changing or evolving, go see your dermatologist, have them look at it. It only takes a moment.
And don't be afraid, because just because you may have a weird mole, it doesn't mean that you have skin cancer.
Absolutely. The best thing you can do is just get information. Be smart. 99% of melanomas have a 5-year survival rate of 99% if you catch them early. So early intervention is key.
How early is early?
Early is early. So once it's on the skin, it starts to grow either laterally or deep. You want to catch it when it's in that lateral growth phase. So early detection is key. Also, you want to remember that the sun, you can protect yourself from it. You can wear sunscreen, you can wear sun protective clothes, and unlike other forms of cancer, you actually can see skin cancer. So it's an opportunity for us to take charge of our health and get it caught early.
That's huge. Would it just be physical signs, or would you have some kind of physiological signs, like you don't feel well or anything like that going on?
That's a good question. You know, if caught early, they're in the skin. Now, when they have spread to other parts in the body, which can happen with melanoma, and some advanced squamous cells, you could begin to feel ill. But we're talking about catching them early before there's anything else than a sign on the skin.
Catch it. Skin cancer, very preventable,
very preventable.
Easy to detect, but
easy
if you
to
get
detect.
it, easy to treat.
Easy to treat. If you see your dermatologist, when you notice something changing, they can get it off of you, and you can be really in a good position to not have it come back.
All right, Dr. Sherry Ingraham, thank you very much.